One of the things that we'll start thinking about towards the end of your pregnancy is contraception after we're done. There are multiple options. The two options that are really available pretty soon after delivery are a mini birth control pill that's made up of progesterone only. This is a great birth control pill for people who are breastfeeding, as it does not interfere with breast milk production. It's also very, very effective as long as we are breastfeeding. Once we've decided to stop that, we'll need to choose a different form of birth control because it does become significantly less effective at preventing pregnancy after that point. The other option that's available fairly early is the Depo-Provera injection. That's an injection that goes in your arm or in your bottom, and we get one injection every 3 months. Feel free to visit with your doctor more about those side effects related to Depo-Provera. Some of the other options as we get a little further out include things like a combination hormone birth control pill, so those have usually estrogen and progesterone in them. Those are the traditional birth control pill that you take one pill every day. They're wonderful at, giving us shorter, lighter periods that are predictable. Many of them even help with things like acne. They do have side effects, including nausea, headaches. Those are usually pretty mild and usually go away within the first 3 months for most patients. Some more rare side effects can include things like blood clots. So you should talk with your doctor before choosing that about your specific health and risk factors to make sure that that's a good choice for you. Some similar options that have similar good things and bad things that birth control pills do are things like the NuvaRing. The NuvaRing is 1 ring per month in the vagina. It's very helpful for patients who do not do well remembering a daily pill. The other option that's similar would be a birth control patch, and the patch is usually placed on the skin one every week, and we'll change that every 3 weeks, and then the 4th week take a break and have our period. Some other options include longer term things. So there is a 3-year rod that goes under the arm called Implanon. That's a great option. And an IUD. There are 2 types. There's a 5-year IUD called the Mirena that goes inside the uterus, and a 10-year IUD called the Paragard that goes inside the uterus as well. The Implanon we usually put in about 4 weeks after delivery, and either of the IUDs usually 6 weeks after delivery. Both the Implanon and the Mirena, or the 5-year IUD, tend to have favorable side effects with your period long term. So usually people have lighter, shorter periods after an adjustment period on those. Some women get lucky and have no periods at all, which is safe as long as we know what's causing that and as long as that's something that we're controlling. The Paragard IUD tends not to have those side effects on your menstrual cycle, but is very good for long-term birth control.